Eliminate your pain, increase your motion, strengthen your shoulder, and develop greater coordination, endurance, and proprioception in the shoulder are the 4 major outcomes that you'll get from watching this video. If that's why you clicked, because you want one of these 4 benefits, then stay tuned. Welcome to High Thriving Health. I'm Daniel Torres. This video I'm going to show you some of the best physiotherapy for rotator cuff tears out there. So we'll first talk about how to eliminate the pain in your shoulder. Then we're going to talk about how you can increase your range of motion for every direction of the shoulder. After, we'll go into strengthening each of the 4 rotator cuff muscles and the surrounding muscles for stability. Finally, we'll look at how to optimize coordination, speed, and motor control for the shoulder. So by the end of this video, you'll have the full package of physiotherapy for rotator cuff tears and shoulder injuries. If that sounds good, give me a thumbs up and subscribe to my YouTube channel. That way you get notified of my future videos, which will teach you how to maximize your health, your happiness, and success. Let's get started. Let's first start on eliminating pain in the shoulder. The best way to reduce pain is called directional preference exercises, which are simply doing exercises with movements that alleviate your symptoms or increase your function. To do this, we need to test every direction of movement that the shoulder can make to discover what specific movements will aggravate your symptoms and what specific movements improve your symptoms. As we go through each direction of movement, you want to perform each movement 10 to 15 times all the way to its end range and monitor what your symptoms do during the exercise, in particular if your symptoms improve or if they worsen. You can use a chart such as the one shown here to record your findings. First direction is flexion, which is where you simply raise your hand above your head. Go as high as you can to end range. For extension, you simply bring your arms back behind you as far as you can while keeping your elbows straight. Now we have external rotation. You're going to keep your shoulder at 90 degrees and a bend in your elbow at 90 degrees, and you're going to bring your hand up and behind you. Same position with the internal rotation, but you're going to go the opposite direction. You're going to bring your hands downward. You can also perform both external and internal rotation with your arms at your side rather than your shoulder up at 90 degrees. Abduction, you're going to raise your arms out to the side. Adduction, you're going to start with your arm extended out at your side and then bring it close to midline. For each direction of movement which either reduced your pain or improved your range of motion, perform 10 to 15 reps of each movement every 2 hours and whenever your symptoms come on. So for example, if flexion, external rotation, and extension was helpful, then you would do all 3 of those movements every 2 hours, 10 to 15 reps each. These are beneficial movements that not only will eliminate your pain, but are going to help correct your derangement. Now, having gone through each motion of the shoulder, there may have been movements that were not full for you, that need to be worked on. So let's talk about how we can improve motion in the shoulder. We're going to do this by using passive stretches assisted with a stick, towel, or possibly a PVC pipe. Keep each of these stretches pain-free. For pendulum swings, use one hand to hold onto a table or bench while letting the affected arm hang freely. Use your body to move your arm in small circles in both clockwise and counterclockwise directions. Then make big circles in each clockwise and counterclockwise direction. Then swing your arm from side to side. Lastly, swing your arm forward and backwards. Do 10 to 15 reps in each direction. The key with this exercise is the shoulder is not engaged. It's the body that's creating the movement at the shoulder. Pendulum swings acts as a pain reducing exercise because it creates gapping in space at the joint, allowing a release of pressure around the shoulder tissues while simultaneously passively warms up the muscles. So if you're having any type of shoulder problem, you'll want to do this every day and before any type of shoulder workout. Next we have wall crawls. To do this, you'll face a wall and then slowly walk your fingers up the wall. You walk up the wall as far as you can, and once you've reached your maximal height, hold at the top for 3 to 5 seconds and then slowly walk your fingers back down. Repeat this for 10 repetitions. Wall crawls is both a therapeutic exercise and a measurement protocol. It will allow you to see how well your overhead range of motion is doing. Flexion with a stick. Bring your arm straight out in front of you, then raise it up above your head while using the stick to apply overpressure. Hold at the maximum stretch for 30 seconds. Forward lean. Reach one hand out in front of you and grab the backside of a chair. Slowly relax your shoulder as you lean forward and push your chest towards the floor. Keep a straight back and hold at the bottom for 30 seconds. External rotation with a stick. Bend your elbows to 90 degrees and keep your arms at your side. Slowly push your hand out away from you. Hold for 30 seconds. Internal rotation with a stick. Your affected arm is going to be behind your back at the top position. Your unaffected arm is going to be below your affected arm, and it will be used to push your affected arm slowly up your back. Hold at the top of a stretch for 30 seconds. The sleeper stretch. Lay on your side with your arm closest to the ground, extended out in front of you, and the shoulder should be raised to about 70 degrees and your elbow bent to 90 degrees. Then gently push your arm toward the floor and hold for 30 seconds. This is a arm cross stretch or horizontal adduction. This will stretch the posterior shoulder. So using a stick, pull your affected arm across your body until you feel a stretch and hold for 30 seconds. Now, when you're strengthening a shoulder injury, you usually want to start at the most basic level, which is isometric strengthening. This is when the shoulder does not actually move during the exercises. What we're gonna do is you'll push your arm against a wall in every direction for 10 to 20 seconds at a time. Start with only one set and then progress up to 3 sets of 10 to 20 second holds for each direction that the shoulder can make. Isometric flexion. Stand facing a wall, make a fist, and keep your elbows straight, and gently press your fist into the wall as if you're trying to raise your arm straight out in front of you. Hold this contraction for 10 seconds and repeat this for 2 more times. Isometric extension. Stand with your back to a wall and make a fist and keep your elbow extended. Then gently push the back of your hand into the wall. Hold for 10 seconds and repeat 2 more times. Isometric external rotation. Stand perpendicular to a wall with your elbow bent to 90 degrees. Keep your elbow firmly against your side and then press the back of your hand into the wall as if you were trying to rotate your forearm away from your body. Hold this contraction for 10 seconds and repeat this 2 more times. Isometric internal rotation. Place the inside of your hand against a wall with your elbow bent to 90 degrees. Without moving your elbow away from your side, press your fist or your hand into the wall as if you were trying to move your forearm toward your abdomen. Isometric abduction. Stand perpendicular to a wall, make a fist, and gently press your arm into the wall as if you were trying to raise your arm out to the side. Hold this contraction for 10 seconds and repeat 2 times. Isometric Adduction. With your arm extended, place the inside of your hand or fist against a wall and gently push into the wall as if you were trying to bring your arm across your body. Hold this contraction for 10 seconds and repeat this 2 more times. After you can perform each direction of isometrics with no pain, you'll then want to advance to dynamic exercises. These can be used with a rubber band resistance or dumbbell. If you have sharp pain during or after one of these exercises, stop and lower your weight or resistance, retry the exercise, and if it still hurts, then stop completely and keep working on isometrics. Front raises. Raise a dumbbell straight out in front of you. Lower, under control, and repeat 10 reps. Lateral raises. Raise a dumbbell out to your side to about the shoulder height. Lower under control and repeat 10 reps. Internal rotation. Lay on your side, rest your elbow on the floor, and keep your elbow bent at 90 degrees the entire time. Slowly lift the weight in toward your abdomen. Lower back down and repeat 10 times. External rotation. Lay on your side, keep your elbow bent at 90 degrees the entire time. Start with the dumbbell near your abdomen and slowly lift the weight up as if you were bringing your arm away from your abdomen. Then slowly lower the dumbbell back down toward your abdomen and repeat 10 times. Shoulder extension. This is going to work the posterior aspect of your shoulder. You're going to need a bench to lean on while keeping your elbow straight, and then raise your arm up behind you as high as you can. Lower very slowly and controlled, and repeat this 10 times. Bilateral scaption. This is a similar exercise to front raises, except you want to externally rotate your thumbs or your arms so that they're pointing outwards. Raise both arms up in an overhead Y position. Concentrate on squeezing your shoulder blades towards each other and slightly downwards. Lower the weights and repeat this 10 times. This exercise will target not only the rotator cuff muscles, but also the lower and middle traps to help stabilize the scapula. If this has been valuable for you so far, let me know by writing one word in the comments: yes. The final piece of the puzzle is to restore coordination, speed, control, and balance. This can be accomplished by performing a P and F cross pattern exercise and a push-up on a balance board. Start by crossing your arm over your body with your hand pronated, or the thumb is pointed downward towards the floor, like you're grabbing an imaginary sword out of your pocket. Then pull your arm up and across your body while turning the inside of your hand toward the ceiling. Keep extending your arm until it's up in the air, fully extended on the same side of your body, then reverse the pattern going down. You'll want to use a lighter dumbbell, something that you could do 10 to 15 reps with in each direction. The second version of the PNF cross pattern is very similar to the first, except for we're going to do the opposite motions with the hands and wrist. You're going to start with your hand or palm facing in a supinated position upward toward the ceiling. Then slowly pull your arm up and across your body while turning your hand downward or in a pronated position halfway through, so the inside of your hand's facing the floor. Then continue to raise your arm up until it's extended above your head fully on the same side of your body. Reverse this pattern going down. Push-ups with a balance board. This is a fairly simple exercise. You're going to start by placing your hands on the side of a balance board. Keep your back straight and your core tight. Lower your body until your elbows are around 90 degrees. Pause at the bottom for 1 second. Raise your body back up to the starting position and then repeat. This is going to challenge your stability, the coordination, and balance of the shoulders. For absolute optimal results in the shoulder, you'll need to improve its relationship with the thoracic spine and ribs. Fortunately, I have a whole other video that demonstrates and teaches you exactly how to fix rounded shoulders. The link is in the description. Make sure that you watch that video and follow each of the steps. For results, wellness, or training programs, check out my website at highthrivinghealth.com. Here again are the 5 steps to fix your rotator cuff problem. First, we want to get out of pain using directional preference exercises. Then we need to work on range of motion, followed by isometric exercises. The isometric exercises will lay the foundation to apply dynamic exercises. Then the final component is to incorporate PNF and other advanced training. If you haven't already, be sure to subscribe, give me a like, and follow me on Instagram at highthrivinghealth. Until next time, stay tuned.